I want to welcome everyone to our first World Movement Disorders Day. This is the first of its kind. And I'd like to introduce our co-host. Okay, there's Darlene. Dr. Darlene Mayo is a neurosurgeon and a neuroscientist. She is also one of our DSF board members and the director of our medical advisory board. And Darlene will be overseeing the meeting for us. Yes. And then also Dr. Drew Christensen, and he founded Living Health Functional Medicine in 2014. He is also a member of our DSF Medical Advisory Board, and he was diagnosed in 2014 with essential tremor. So he does understand what we're going through. And this is Dr. Brady Dorn. He is the owner of Dorn Chiropractic. He's also a member of our medical advisory board. And we are going to try and answer all the questions that you have submitted. And we're going to have fun today talking about ET. Darlene, I'm going to let you take over.
All right. Well, thank you, Diann. Yeah, I think this is just going to be a wonderful meeting. So we have a lot of questions that were submitted in advance, and I think we'll just do a round table. I think that worked really, really well when we have done that before. So we can go ahead and get started, but I'd like to ask Dr. Christensen or Dr. Dorn, did you have anything that you wanted to share in particular before we get started with the questions? If you do, that's great. And if you don't, that's okay too. So we can just dive right in. So
I'll go ahead and just do a quick, brief explanation. So I was diagnosed with essential tremor when I was 14 years old. So I've had it for over 40 years, and essential tremor actually caused me to get, I was accepted to medical school, and then when they saw my tremor, they actually said I couldn't go. So I had to switch medical schools. I later also got ejected out of a surgical residency in OB because of my tremor. So I kind of get where you guys are coming from. Tremor has altered my career and my life in many ways. And I've been to many doctors, many providers to try and find a fix for it. I've been on medicine and experienced a lot of side effects, decided not to take medicine anymore. And just during COVID, my medical practice just kind of died. And I finally decided that I needed to figure out a different way to approach essential tremor. So I founded something called the Shake Free, and Shake Free helps patients address their tremor without medicine and surgery. And so that's one of my main focuses in my medical practice right now, is helping tremor patients address those things that they can address without medicine and surgery when they need alternative therapies. So that's kind of my big focus.
That's wonderful. Thank you for sharing that. And yeah, it's so interesting to me that you said that, Dr. Christensen, because I know when I was actively practicing doing surgery, nobody, even at the medical conventions, really talked about the fact that there are other things to do other than 2 medicines or surgery, right? I mean, it wasn't discussed. And, as I transitioned to doing more online consulting and I started doing my own research and finding that out, it floored me, the number of alternatives available that don't involve traditional medicines, that don't involve surgery. So I'm sorry that you had the journey the way you did, but I love that, we're all very much aligned in that vein. So Dr. Dorn, would you like to share a little bit?
Yeah, I've been in practice for over 20 years, and I appreciate, Diann giving me this opportunity. I got involved through Cheryl Madison, who's right there. She's been a long time patient of mine. We've, seen her for probably about 15 years. We've been working together. Just for her having essential tremors and what she does on a daily basis, as involved as she is in the community with her family, it's just really remarkable. And so, understanding like her disease with essential tremors, and we kind of experiment with, nutritional stuff, with different exercises, just with different protocols at the office, and she just felt like there was some benefits that she had received. So we're always kind of looking at new research, different things that we can kind of tweak, and she's always a fair game to do different things. So so yeah, a lot of my postgraduate work I've done in neurology, rehabilitation, nutrition. I've got what's called a low-level laser at the office, so we do a lot of like concussion work. We've got patients with other neurological disorders that we work with. So it just, for me too, just a great opportunity just to talk to all you guys and just to understand what people with ET are looking for, and how I can grow as a practitioner too.
Okay, wonderful. Well, thank you. All right. And for those of you that don't know me, I practiced for a number of years, mainly in the field of functional neurosurgery. So I was doing a lot of deep brain stimulation, most recently at the Cleveland Clinic. I spent the bulk of my practice years there. And now I really work in a very holistic way with individuals. I'm not doing active surgery at the moment. And so I'm delighted to be here. I've been with Diann Shaddox Foundation for I think 3 or 4 years now. It's been a little bit of time, and it's just been such a pleasure to be able to share information about what is possible. Because I think so many times, this is one of the things I saw in practice is, well, the limitations, the focus was on limitations. And I'm always asking the question, well, what can we do? And I think that's why we're all here together for that. So with that, we can go ahead and start with questions. So first question that we had come in, pretty simple, basic, but I think is a good place to start, is how is essential tremor diagnosed? So Dr. Christensen, would you like to take that one?
Yeah, so I think it's really important for patients to actually see a movement specialist. So that is somebody who is trained in neurology, but then specializes in movement disorders. The reason why I think that is really important is because the way that the literature and the diagnosis has changed over the last few years, the recommendation right now is actually not to diagnose anybody with essential tremor until they've had it for 3 years. And the reason for that is because it can be a little bit of a tricky diagnosis. For example, I've had patients come into me that have had a diagnosis of essential tremor, and they ended up having Parkinson's disease and not essential tremor, or they had dystonia and not essential tremor. And recently I had a patient come in and he actually had ALS and not essential tremor. And so essential tremor can be a little bit of a tricky diagnosis because there's other things that can kind of accompany the tremor and can sometimes make the diagnosis tricky. And so the way it's diagnosed is really kind of twofold. One is by history. What is your history of your tremor? It's more likely to be essential tremor if it runs in your family, for example, because there's a genetic component to it. It used to actually be called familial tremor because of that family tendency. So the history of your tremor really helps with the diagnosis. What kinds of activities are you involved in where you notice your tremor? And then an exam with a neurologist or someone experienced with essential tremor, I think, is really important. Some of the characteristics of essential tremor is it tends to be what we call an intention tremor, or a tremor that's activated by activity. So that means, if you're sitting still, usually the tremor isn't there. That's not always the case, but usually that's the case. And then when you go to do something, you go to get that drink of water, or you go to brush your teeth, that's when the tremor becomes manifest. And so that's, you're moving with intention. So for example, when we test somebody in the clinic, one of the things we have them do is touch their nose and then point to something. And as you see my hand shaking as I point, that's very characteristic of the tremor. And so the diagnosis is really made by your history and then by an exam, but then it's really, really important to rule out other causes of tremor. For example, medicines can cause tremor. So antidepressants, for example, are some of the common medicines that can contribute to tremors. You can also have other things that cause tremors. So if your thyroid isn't functioning, that can cause a tremor. You can have something called Wilson's disease, which is a copper imbalance in your body that can cause tremor. So it's part of the diagnosis is ruling out all of these other causes that potentially could be causing that tremor. And so it's really quite involved when you start looking at it. And then once we suspect that it is essential tremor, like I mentioned before, then we really actually need to watch it over the course of 3 years before we actually officially make that diagnosis of essential tremor. So that's kind of a long drawn out answer to the question.
It was a great answer.
Yes, I thought that was very thorough. That is wonderful. So I think that I love that you brought up the 3-year diagnosis, because there was a recent study that showed that there was even a lot of crossover between PD and essential tremor. And so it's important. I think that is a diagnosis. I also love that you brought up having a movement disorder specialist. That was another question that had come in, so we can just address that now. That's something that I found, and you can speak to this too, but general neurology training, very little information about movement disorder, quite frankly, even in a residency program. I mean, we would sometimes have the neurology residents rotate through, even surgically or in our movement disorder center. And, but it was pretty rare in that level of knowledge. It's pretty intensive when you do a movement disorder fellowship. I mean, it's a year or two of very intensive training and learning how to make that differential diagnosis. And so I always recommend, sometimes people think going to a general neurologist is enough, but really that training in movement disorders is really key if you want a proper diagnosis and treatment.
Yeah, I think that's really important as well. The reason why it's important is because different movement disorders originate in different parts of the brain. And so if you get a diagnosis of Parkinson's disease, then we're really looking at a whole different treatment than if you have a diagnosis of essential tremor, because they originate in different parts of the brain. And so the way that we treat those would be different. Even when we treat them with alternative treatments, we're really targeting the root cause or the origin of that tremor. So a really good diagnosis is really important.
Okay, thank you. Dr. Dorn, there were questions about some alternative treatments, including doing different types of exercise and maybe even Tai Chi versus some other types of exercise that were noted by one of our individuals who submitted a question as being helpful. Would you like to speak about that?
Yeah, sure. Dr. Drew too, with your experience over the years too, just kind of, jump in too, okay? But when we're working with a lot of our clients at the office, we will, I've got a Durex pad, and it's just a foam pad that we'll have them stand on. And we just want to, stimulate the cerebellum, the thalamus. So we'll just do some of the, the basic stuff that you guys always see done. We will, we've got like the band. I think this is something people can do at home. You want to just try to use the bands. And you just really want to try to hold it for a little while if you can, maybe 15 to 20 seconds. We also use, a bigger band, but there's a study that just came out not too long ago. It was talking about with the hand tremors, they had people do, bicep curls. They had them doing the wrist. They had them doing just the wrist flexion and wrist extension. So what they had them do is they had them do like a 5-rep max, and they did it was twice a week for about 55 minutes. And then what they would do is they would start off maybe just their body weight, maybe do like 3 sets of 15. Then they would use like a light dumbbell and do maybe 3 sets of 8 to 10. And they would try to then use like 3 sets, like with their max of like 5 reps. And they just found that did definitely help with the hand tremors as well. So those are a couple of things at home. Like you said, as far as like Tai Chi, some of those slower movements, I think would be great. And then I'm trying to think what else. I guess, yeah, those are the main ones, I guess.
All right. Well, thank you for that.
Okay.
Dr. Christensen, did you want to? Oh, I'm sorry, Diann.
Yeah, no. Okay. Brady, Dr. Dorn, maybe we can get a list of that and we can put that on the website, some of the things that you're talking about. And
Sure.
so others can see and, work on that, because it does. And that's something, Darlene, I know you've seen, is the exercise, like you said.
Yes.
It is very important for people with ET to keep exercising, even though it's one of those things you exercise and then all of a sudden you're tremoring.
Yes.
But you need to keep up the exercise. And if you get the correct exercise with Drew and Brady, which ones that can help with the muscles and stimulate the body for ET.
One other thing I forgot to mention is even just taking a tennis ball. And what they found is if you just squeeze a tennis ball or something similar to a tennis ball, and you squeeze it for about 3 seconds, release, hold it for about 3 seconds. If you can do that on both hands too daily, they found that's helpful. Even just something simple as like drawing. You guys have probably seen that where you just you hold your pen, you keep your elbow, keep your elbow and your forearm off the table, and you just try to draw those. I'm sure you guys have done that before. Sorry for the artwork, but you've done those, both ways too. So that just those little things where you work in the fine motor and like the gross motor, I think is great.
Well, that's what we need to do. We need to get the list and we need to help, because people don't realize when we say exercise, we don't mean you're going to go run a marathon or you're going to the gym and lift all these weights and, simple things can help.
Yep.
And we will get that, onto the website.
Okay.
And Drew and Brady and anybody who wants to add anything that helps them, that would be wonderful. Okay.
Yeah. And I just want to add along those lines too. Your tremor may get worse immediately after exercise, but the long term, what you're going to see after a few weeks is improvement as you're strengthening those muscles. But Also, people don't understand when we say exercise, they think, oh, I've got to do 30 minutes or whatnot. No, you do not. Actually, you can train your brain very easily, even with 5 minutes a day. Okay. And what'll happen is you'll begin to lay down those pathways for exercise. It gets easier and easier. Your brain, actually, the more you do something, the easier it gets to do it over and over. It takes less and less energy. So start with 5 minutes. And even if 5 minutes is too much, start with 3 minutes, right? Set a timer. And then what you'll see is over time, you will really improve your stamina along those lines. But I love, Diann, that you mentioned even, or maybe it was Brady, putting your elbow down, right? Because guess what, as surgeons, we actually have tricks, okay? Because everyone has a degree of physiologic tremor as well, right? And when we're doing brain surgery, actually very technical brain surgery, we actually use a ring around the head and we'll rest our elbows, and that makes our hands a lot steadier, and that also can help in cases of essential tremor. So if you're trying to do something like that, that can be very helpful for those that are artists, right? You can use different kind of props like that to help. So little secret from surgery, don't tell me.
That's good. All right.
Yes. So, all right. So a question came in about using weighted utensils. How helpful are they actually? Do they actually work or not? I don't know. Dr. Christensen, would you like to address that?
So certainly using weighted utensils does make a difference. And really my focus is really trying to increase function instead of just using tools that just decrease tremor, if that makes sense. And so I really think it's important to do the exercises that Brady was talking about. The literature is really clear on strength. When you have increased strength, the tremor does improve. And a lot of you that have tremor, you may notice that your dominant hand is a little bit better than your non-dominant hand when it comes to the tremor. That's not always true, but in many of the people that I see, that is true. And when you think about that, your dominant hand and your dominant arm is just stronger and also has more experience doing those activities. And so one of the things that I tell my patients is if something is difficult for you to do more of that, because that's actually going to train your brain to do that better. So if it's harder to, brush your teeth with your left hand than your right, then practice brushing your teeth with your left hand. It can really make a difference. But weighted utensils make a difference. Things that have a bigger circumference on the handle make a difference in the tremor and how you're able to perform. Weighted plates, if you've ever tried to carry a plate full of food, when it's a little bit heavier, it makes a difference. So the weighted utensils with big handles do make a difference, make it easier to eat. But I also think it's important to just practice doing those things that are hard for us to do.
Yeah, I think that's a really good point. The other thing I want to say along those lines too is anything that you can do, any activity that involves both hands at the same time is actually excellent for the brain. This is helpful for anybody, but especially if you're dealing with essential tremor, right? Because what you're doing is you're getting flow between both sides of the brain and activation. So for some of you with milder essential tremor, perhaps trying to play a musical instrument, that can actually be extremely helpful. Obviously, if you have severe tremor, that might be a challenge, but any activity that involves both hands is very, very good for your brain as well.
Yeah.
All right. So let's see, we've handled a lot of these. Okay. How about, okay, so there was a question about there were several questions about what are the new medications coming out. So we actually recently, our last ET Talks, we had Jazz Pharmaceuticals here, and they shared about a clinical trial that is in phase 2. So they are really studying efficacy and safety at this point. They had some very positive results from their initial trial. And so it's probably, I think, what did they say, Diann? I think they said if it goes through phase 3, that it'll probably be another couple of years after that.
It is.
But
it is.
But you can still, they're still recruiting. So if it's something that you would like to participate in, you can definitely, we have that information posted in the Facebook group, and we can highlight that again as well. And there are a number of other clinical trials going on right now, but really, our mainstays for medicine right now are really two medications, so primidone and propranolol. So we do use some other ones at times, but there's pluses and minuses to those. So in my experience, and then I'll let the other two panelists chime in as well, and then anyone who would like to chime in who's used them, certainly please do that. But generally what we see is about 50% of people are helped to some degree. And when we say to some degree, it is up to about 50% improvement. Those are the statistics regarding those medications. There's, we typically start with a lower dose and then increase that over time. But there can be some side effects, and there may be some reasons why you cannot take certain meds. So propranolol, if you have any respiratory issues, generally we don't like to prescribe that because that's a contraindication. Primidone, it really doesn't have a whole lot of contraindications, but it has some side effects sometimes and can make you sleepy and some other issues as well. So if Drew or Brady, do you want to add anything to medications before we talk about surgery?
Really, still the mainstay in medicine is propranolol and primidone. Those are the two main ones. Probably the number 3 one would be Topamax, which is another type of anti-seizure medicine. What some of the studies show is that when people start these medicines, about a third of them will stop the medicines for one reason or another, whether it's not working for them or they don't like the medicine. So that's something to keep in mind. Some of the newer medicines that are coming out are focusing on a little bit different mechanism that seems to be helpful for essential tremor, and they're working on what we call calcium channels, a very specific kind of calcium channel. So it's going to be interesting as we see more of these medicines get approved and how they can help. The thing that I like to really teach people about is that, the things about, there's really 3 big problems with tremor. One is the obvious, the disability that happens with tremor. But the other 2 things that I think are really important to be addressed is the social aspect of tremor and the mental aspects of tremor. So it really, I call it tremor trauma. And it's embarrassing to have tremor. We tend to hide socially. And when we do that, it doesn't help our brains. And then the other big thing about tremor is that it is what we call a neurodegenerative process. So that means that there's part of the brain that's degenerating. And what we're finding in the literature is that essential tremor is associated with other brain problems like cognitive difficulties, so difficulties in our executive functioning of our brain. It's associated sometimes with balance issues, hearing issues. And so it's really important to realize that if we're taking a medicine that helps our tremor, we're still not addressing the neurodegeneration of the process. So it's really important to take care of our brains and to take care of our health in general so that we can hopefully slow down the progression of tremor. That's a deviation from the medicine, but I think it's important to realize that for a lot of years, I took propranolol and it allowed me to practice medicine, right? But I wasn't addressing my diet and the neurodegeneration that was happening inside my brain with that medicine. The medicine was helpful and that was great, but we also need to really address our overall brain health at the same time.
Yeah, I think that's a really good point. I think that we don't talk about this enough, especially physicians. We don't talk about nutrition, but it really is very important. If you're not providing your brain with the building blocks it needs to function properly, you are limiting yourself, right? And any health condition that you have is going to be worse without that. And so I think that is really important. And whether you go to your primary doctor for that, whether you go to a homeopathic doctor for that, that's very important to even have those levels checked, right? Have your B12 levels checked, your other B vitamin levels, vitamin D, all of these things, very important. And then I also want to say this, because this is something I wasn't really aware of in practice, but a lot of times we expose ourselves to toxins, right, in the environment, and they're just around, even if you try not to, right? They're everywhere.
Right.
They're in some of our foods, right? And so having a safe, gentle way to detoxify your body on a regular basis. I mean, ideally, yes, your liver should perform this function, your kidneys should perform this function, but when there's so many toxins in the atmosphere and the foods and whatnot, and even we're in the holidays, right? And people put out all these little candles. Most of those have a lot of toxins in them, right? And so having a plan to really address that and detoxify your body as well as build it up with healthful nutrition is really, really important. I don't know, Dr. Dorn, I saw you shaking your head there a little bit. So did you have something you wanted to add?
Right there. I think just a key thing is just really having more of an anti-inflammatory type diet, right? Like what are we putting into our bodies? So I mean, a lot. I know like keto diet, some of that stuff they found like some brain health, but I mean, as far as a Mediterranean diet, I think that's just safe. It's something that people can get on and stay on, versus a ketogenic diet. So, I think maybe just limiting your gluten, sugar. I think some of the excitotoxins like MSG, aspartame, try to stay away from there. I just was reading something they said about coffee possibly affecting essential tremors. I don't want to get anybody mad, and I don't know, maybe I'm wrong, but that was something I was reading about the other day. So, and what about as far as like nutritionally? I mean, have you guys seen anything in the literature regarding magnesium threonate? Because it's a type of magnesium that you're studying at MIT, and it's in PubMed, and they're talking about how it's one of the types of magnesium that gets past the blood-brain barrier. So, as far as like memory, Alzheimer's, there's some promising research coming out on that too.
Yeah, so I use magnesium threonate in all of my essential tremor patients. I think it's really important. Magnesium is calming on the brain, and magnesium threonate gets into the brain. And one of the things that the brain can become overexcited is one way to think of it. When it becomes overexcited, then its function isn't really great. And one of the things that causes that excitation in the brain is glutamate. And one of the things that can kind of help calm that glutamate response in the brain is magnesium. And so magnesium threonate is a really good tool And some of the people in our tremor group have noticed improvement with their tremor taking that. We don't have any studies in essential tremor on magnesium 3 and 8, but I think it makes sense, and I use it in everybody.
Is there any contraindications with people being on medication and magnesium 3 or not?
Generally not. You would certainly, maybe be a little bit cautious if somebody has, something like a seizure disorder or something like that, or you're watching magnesium for other reasons like heart conditions, things like that. But generally speaking, there's not really contraindications to giving magnesium.
Is there a dosage that you found, to start with or to ease into, or therapeutically that's beneficial?
The dose off the top of my head, I don't know. I just know the brand that I have in my office is Designs for Health. And their version of that is called Neuromag. And I have people start with 1 capsule at night, and then I have them slowly build up to 3 capsules. It's pretty potent. Some people will have vivid dreams when they start it. So I call them Rambo dreams. It's very, very helpful.
How about fish oil?
Fish oil, I think, is a no-brainer as well, because we're trying to build healthy membranes in the cells, and those good omega-3 fatty acids help to build good membranes in the cells and in the neurons of the brain. But part of fish oil is EPA. That's one of the omega-3 fatty acids that can actually decrease inflammation.
Right.
And so in my practice, we actually measure inflammation, and we measure the fatty acid levels. And fish oil is really important. You just want to get a good quality one so you're not increasing your toxicity when you're taking the fish oil.
How about, sorry, one more question. As far as like CBD, like a broad spectrum, a full spectrum, with our CBD1, 2 receptors in our body, have you found any benefits with that with your patients?
So there's a study right now going on with marijuana, cannabis, and essential tremor. The results of the study are not out yet. There have been, I've seen so far just one study when I was looking the other day with CBD and tremor, and they did not notice significant difference. But I will say that I do have patients that notice a difference in their tremor with CBD.
Now, is that with a broad spectrum or full spectrum?
With a more of a broad spectrum.
Okay.
And personally, I find that it helps my tremor a little bit. I think it's very calming on the nervous system, and I think part of what makes tremor bad or worse is when we overstimulate our fight and flight nervous system. So when we get overexcited, so when we're stimulating that sympathetic nervous system, it really brings out the tremor. So things like CBD can kind of help calm that. And in turn, I think secondarily, that tends to calm the tremor.
Okay.
Yeah, that's super helpful. Thank you for that. I think maybe if we can host a session on nutrition, I think that would be super helpful and very focused for everyone. So maybe we can plan that for something coming up and we can gather all of this information with, prescribed dosages or recommended dosages. I mean, obviously these are supplements we're talking about, but, I think that would be very helpful. And then even along the question of CBD, I know that copaiba oil, essential oils have been very helpful for some individuals as well. And that actually has a calming effect on the nervous system as well. I love that that was brought up. We don't think about this, but we have the sympathetic nervous system that excites everything, right? And then the parasympathetic nervous system that kind of is your homeostatic or calming system. But really anything that can help induce that parasympathetic activity. That's why even Tai Chi, yoga, right? Some basic yoga, obviously not the complex yoga, but those types of activities can be extremely helpful. Even some basic stretching that you might do through physical therapy or through chiropractic can really induce, and massage even can help to induce the parasympathetic nervous system. And that's something really important. You don't want to discount it, right? I mean, I think we've talked about, you can treat the tremor. You can treat the tremor with some medication. You can treat the tremor with surgery, right? But even, there was a research study that I hosted and served as PI on, where we studied when there was depression or anxiety with essential tremor, okay, which is very, very common, by the way. Some statistics say 50%, some are higher than that, 75, 80%, right? Okay. So what we found is that if we were not concomitantly treating depression and anxiety, even if, listen to this, even if on the tremor scale after surgery, we could see a significant improvement, on the old fashioned scale where we went from a 4 to a 2, we have newer scales now, but patients would feel like they had not improved if their depression and anxiety was not treated. Okay. So it really is important to address the whole patient here. And I think that, this organization just does a beautiful job of really emphasizing that, Diann. So thank you for bringing together the professionals that understand all of this. I think that's so important.
Well, that's the point. We've got 3 people right here, well, 4 with Stephen, who are sitting here with essential tremor. So you have to understand what's happening with us, and who better than the people who live it. And that's what we're doing. And that is what is bringing this on. And I love this, that we're all thinking out of the box. We're not staying right here. You have to take this medicine and that's it. There are so many ways to help people who are living with ET. And this is great. Stephen, you've been quiet. Ask your question. You're here. You've got the doctors. Talk.
You got to mute
it. I forgot actually the question I submitted. But I did want to ask Dr. Christensen, because I had a neurologist. I've been through quite a few over the last 2 years. And one of them, when I mentioned I was on omega-3 fish oil, he said, stop it immediately, that it would actually is causing damage to my nervous system. So I was kind of interested when you said omega-3 is actually good for essential tremors, and maybe it's because of what you mentioned about the you got to get the right omega-3 products that reduces the toxicity.
So I actually, do blood work that measures the omega-3 levels in my patients. And it's very rare for me to see a patient that has all of those fatty acids well balanced. That most people are low in the good ones and they're high in the bad ones. The bad one's called arachidonic acid, and that causes inflammation in the body. And when we balance that with EPA and DHA, which are the good omega-3 fatty acids. It helps to bring down that inflammation. And when you go back to, cellular biology and biochemistry, the cell membrane is made up of these fatty acids, and your neuron functions, all of these functions really involve the membranes. And so it's hard for us to have a healthy brain without healthy membranes. And so what I find in my patients is that the omega-3s are important in the nutrition in really helping to optimize function throughout our bodies, but really in controlling inflammation. I don't think that it specifically, you take fish oil and a couple hours later, you notice your tremor is better. It's more of overall decreasing inflammation, increasing the likelihood that your cells and your neurons are going to have healthy membranes that are doing what they're supposed to.
Thank you.
Sure.
Okay. All right. Wonderful. Well, Stephen, if you think of your other question, you can definitely ask it. And for those that have decided not to come up as panelists, you can type into the chat if you choose to a question. That is totally fine as well. Or if you decide you want to come up and ask your question, you just let us know and we will get you promoted to panelist. So well, it looks like most of the other questions, we had several questions come in related to deep brain stimulation, a couple of people that are getting ready for deep brain stimulation, somebody that was having questions about after DBS. So I'm going to address those quickly. I know we're coming up on our hour here, but so this is a procedure, obviously, I did for a number of years. This was my specialty. This is something I did probably 50% of my time, I would say, at the Cleveland Clinic. So there's really very specific indications for who is appropriate for deep brain stimulation and who is not. And we do like to say that we like to exhaust everything else before we proceed with surgery. And I think that is really important. That's something that if you go to a movement disorder neurologist, they are likely affiliated with a movement disorder center. And so one of the things we would do is it would never be me making a decision about whether somebody needed surgery or not, right? We would be in the room with the physical therapist, occupational therapist that had evaluated the patient, the neuropsychologist, the neurologist, right? And then myself, as well as a whole team looking at, have we really exhausted everything else? And then are there any contraindications to the surgery? So, obviously it is a brain surgery. It is a relatively, let me say, minor surgery compared to a lot of the things we do as neurosurgeons. It's a minimally invasive procedure. A lot of the time we do the surgery awake, okay, which is something important to know. We obviously give you sedation in the beginning, especially through the initial incision, and then drilling. You have to drill a very tiny hole in the skull and then place the electrodes in to determine the right spot. But the reason we keep you awake is this, right? We want to test your tremor in the operating room. So we'll have you draw the spiral. We may have you sign your name. And then when we place the electrode in the right spot, and different surgeons do this different ways. Some people do recordings first, others just place the electrode based on MRI images. But we always test it in the operating room to make sure, number one, that it's causing improvement in the symptoms, and then that you're not having major side effects, because where we put this electrode is surrounded by some very important structures in the brain that can, if the stimulation goes awry, it can actually cause some significant problems with either weakness or stiffness or jerking movements, even of the arms or the legs. Difficulty with speech is a very common one as well. Now, There are very recently, over the last decade, some electrodes that are called directional electrodes. So they will provide stimulation preferentially in the direction that it is needed and away from structures like the internal capsule that can cause some of those side effects that I was mentioning. But we do like to see that improvement in the OR. And that's actually the reason, many people don't know this, that's the reason I became a functional neurosurgeon, because I actually witnessed, this was in medical school, I was in medical school, third-year medical school, and I witnessed a deep brain stimulation surgery of a lady with essential tremor, and she was having trouble writing. Her signature was illegible. And really, this is what she said. She wanted to be able to write letters to the people that are important to her in her life in a legible fashion. That was what she wanted to be able to do. And when this electrode was placed in the right spot and she was able to sign her name clearly, she started to cry in the operating room. And it touched me so much. And I said, oh my gosh, this can really impact someone's life. And when it's done in the right indications and, with all those safeguards in place. And so I think it is a wonderful treatment in the right cases. I would say, very importantly, if you're considering DBS, you want to go to a movement disorder center, or at least a movement disorder neurologist that is affiliated with other doctors, so they're not the only ones making that decision. You can train any neurosurgeon to do deep brain stimulation. Okay, it's not super complicated to do, but it's really that indication for it. Now, there were some questions about after surgery, and one person said that they were 5 months after DBS and they were still experiencing fatigue. So I would say that's a little bit atypical. Okay, it does take some time to recover from brain surgery, of course, no matter how minor it is. We just typically keep you in the hospital overnight, sometimes a couple of nights for that, but that's a little bit atypical. I don't know that it's the DBS itself, but that is definitely something you would want to follow up with your doctor with. They may want to get a scan and evaluate you, and maybe try some different settings too. I mean, typically a DBS would not be causing fatigue per se, but certainly worth investigating and having that evaluation. So there's a lot more I could say about DBS. I don't want to take up all of the time here, but I did, I do have a book where I've not only described DBS, but also a lot of these other adjunctive therapies as well. So I go into a great deal of detail about the different ways that can be done there as well.
Your book, is that the book that is on, name it?
Yes, it's called Stop Spilling Your Soup, the Complete Essential Tremor Solution. And in it, I described one of the things that was so important to me when I started investigating all the adjunctive treatments that we had. It's got over 50 different treatments that are not medicine and surgery in there. Okay.
And it is on our website on Shop.
Yeah, and let me add, that book is not, and thank you so much, Darlene. It's written in everyday language. You do not have to be a doctor to understand it. It's meant for anyone to be able to read. So I would highly recommend it.
And it's on our website. And before we go, I want everybody to know, you can go to the website. It's Diann Shaddox Foundation.org. And there's all kinds of information. We're going to be adding a lot more since we've had this meeting. We're learning more and more, and we're gathering information. So please go there and you can look up a lot of this. And also, we're doing a membership. It's free. But this membership is special because it is going to bring we're uniting the ET community. This is going to be counting everybody who has ET. So all you do is sign up and say if you have ET, or if you can also sign up to get information and say you're a caregiver or you're a friend or anything. But what we're going to do is count how many people have ET. We want a voice for ET, and we're doing that. So please join us as a membership and keep on helping us with coming up with ideas to help everybody with ET. And happy holidays if we don't get to talk to everybody. I hope everybody has a great holiday and, a happy new year.
And
I
happy
will be
birthday
out
to
there.
Randy and Dianne.
Thank you. I
I'd
know.
like to thank Darlene and Brady and Drew for being here today.
Thank you.
It's been terrific. It's been a really good meeting, and we thank you for doing this.
Sure. Thank you.
You're welcome.
Absolutely, our pleasure.
I second that.
We're going to be doing a lot more of these.
Yeah, get ready, and we'll be putting together some very focused talks too. So you'll know specifically, might be talking about nutrition, might be talking about assistive devices and different things. So,
And exercise.
yes, definitely.
That's it.
All right,
Okay,
everyone.
Happy
Thank
holidays.
you.
Take care.
Happy
Bye-bye.
holidays. Thanks for everything.
Thank you.
Thank you.
Bye-bye.
Bye.